Cardiac output is a very important concept to understand because of its direct relation with blood pressure. As we know, if blood pressure is significantly low, that will affect the amount of blood that is able to be perfused throughout the body. And if that is affected, oxygen, glucose, all those nutrients can't get to the body, resulting in problems. All right, so let's start with the definition. Cardiac output is defined as the amount of blood ejected by that left ventricle of the heart per minute, okay? Now we can see through that definition, there are two factors that come into play. The first being blood volume, and the second being number of ejections. So those two factors are multiplied to give us the answer of cardiac output, okay? Another word for blood volume is stroke volume, okay? There are three factors that affect stroke volume. Now, number of ejections is your heart rate, right? Your heartbeat, okay? So, stroke volume, three factors. The first being preload. Preload represents the amount of blood in that left ventricle just before systole. Systole equals contraction, heart contraction, okay? So preload is the amount of blood in that left ventricle just before your heart contracts, okay? This is also known as your end diastolic volume, right? Because your systolic represents contraction, so diastolic represents heart relaxation. When your heart is relaxing, that is when those ventricles are being filled with blood. So that end diastolic volume is preload. Next factor, contractility. Contractility represents how forcefully your heart can eject that blood given the preload. So, if your heart is able to contract more efficiently, more powerfully, that would increase your stroke volume. Just like if the amount of blood in that left ventricle just before contraction increases, that will increase stroke volume, okay? So preload and contractility are directly related to stroke volume, in that if both of them increase, if either of them increase, it will affect stroke volume by increasing it as well, thereby increasing cardiac output, okay? Now the next factor is different, right? Afterload. Afterload represents the resistance that the heart has to overcome in order to circulate that blood throughout the body, all right? So afterload has an inverse relationship with stroke volume, okay? If afterload increases, if that resistance increases, stroke volume will decrease, okay? Now, let's go into the factors that affect these three factors, all right? Let's start with preload. What would affect the amount of blood in that left ventricle just before heart contraction? What would affect that end diastolic volume? The first being venous return. Venous return means the amount of blood that returns to the heart from the rest of the body, okay? If venous return increases, preload's going to increase, right? Next one, fluid volume. This is just how much blood you have in general in your body. If that amount is low, that's going to directly affect the amount of blood that gets to that left ventricle, right? And then lastly, atrial contraction, okay? Before your left ventricle, where does blood go to? It goes to your left atrium before, right? So if your atria have a hard time contracting, they're not forceful in their contractions, that's going to directly affect the amount of blood that can get to that left ventricle, right? Next, contractility. Ionotropic factors affect contractility, okay? Positive ionotropic factors correspond to your sympathetic autonomic nervous system. Negative ionotropic factors correspond to your parasympathetic autonomic nervous system, okay? Your sympathetic state, your fight or flight, that's going to stimulate, right? It's going to stimulate contractility. It's going to increase contractility, thereby increasing stroke volume. Parasympathetic negative ionotropic factors, that is going to decrease contractility. That is your relaxed, that is your rest and digest state, right? Afterload. Two main things to acknowledge. Hypertension. With chronically hypertensive patients, because their blood pressure is so high, that's going to increase the resistance that your heart has to overcome, okay? Now, what is directly related to hypertension? Atherosclerosis, right? If you have atherosclerotic plaques in the lumen of your vessels, that's going to increase the resistance your heart has to overcome, right? Vasoconstriction. If the vessels in your body constrict, same thing. It's going to increase that resistance that your body has to overcome to get through those vessels, to expel that blood through those vessels, right? Okay, let's move on to heartbeat. What affects heartbeat are known as your chronotropic factors. Now, this is very similar to your ionotropic factors in that positive chronotropic factors relate to your sympathetic state, and negative chronotropic factors relate to your parasympathetic state. All right? So your stroke volume multiplied by the number of ejections per minute, which is your heartbeat, will equal your cardiac output. Thank you very much for watching.